I'll let you know about those times. I don't know. Which county? Call I picked cheese up the.
Several states have banned for
You can dress up prison suspenders.
figure 58. That's my Did you take some cows off the other day? How'd it do? Where'd you go, Glazers?
Good evening. Howdy. It's straight up 6 p.m. I'm going to call the Board of Carter County Commissioners full session to order on Monday, May 19th at 6 p.m. At this time, I'm going to read to you the courthouse egress plan. In the unlikely event that we need to exit this building, our primary evacuation route is the south entrance, which is on the monument side of the building. Our assembly point is the back parking lot on the east side of the building, which is the employee parking lot. The secondary evacuation route is the stairwell across from the elevators, and the assembly point is the back parking lot on the east side of the building. Do not attempt to use the elevator in the event of an emergency. Should there be a need for an AED machine, there is one available on each floor. They are located next to the entrance of the elevators. One quick housekeeping note, the restrooms are located on the north end of the building on each floor. So that would be the audience's left. And the handicap accessible restrooms are located on this floor, the second floor. Does anybody have any questions regarding the egress plan? Okay, so we shall move on to the roll call, item number 3 on your agenda this evening. All right, so we do have a quorum present. I wanted to let you know that Nancy Brown and her husband have traveled back to Duke today. That's why she's not with us. Thomas Prophet had to work this evening, as he is having to do some until he gets time built up that he can get off. And Kelly Collins, I'm not sure, but I know she's having camp. What is it, Camp a Goodbye Bye at Hampton Elementary right now. It's the cutest thing ever. So thank you for your attendance tonight. As we look over the rest of the agenda, there are a couple of changes to note, please, if you all wouldn't mind to amend it and approve it. Let's add item 7B. 7B is going to be the appointments to fill the 7th District Commission seat. I know I'd sent out an email that said we might do it later, but the person who has applied is able to be here with us from this point on. So let's go ahead and do it now. And our clerk, Mary Gooch, has shown up tonight so that we can get this person sworn in if appointed. Also change the mayoral report, which is currently sitting at item 12, change it to item 10, and that will move insurance to 11 and finance director to 12. Does any commissioner have other changes besides those?
Madam Chair.
Yes, Dr. Ingo.
Under 16A, Budget Committee, item number 18, with the motion to approve the animal shelter monetary donations in the amount of 3180.00, strike that and add 2645.00.
Okay, so the item stays in place, it's just an amount change, and I'm sure that you will hear that again when he presents these amendments. Anybody else? Yes, sir.
One comment. I know that why the agenda has changed and we're moving the mayor's report up, but I almost have to say that One Digital is with us tonight to present our employee health care plan. We've got some real issues there. They've got a great presentation, and I know they're coming from Knoxville, so I want to be very cognizant about the time they are in this courthouse else before they go back.
Yes, sir, noted, thank you. Yes, Commissioner Johnson.
Madam Chair, on agenda item B1, under Financial Management Committee, second line, there is, that second line is for Cigna, given a percentage number, which will change from 4 to 1. Everything else stays the same.
Yes, sir. Yes, so that is item 16B1, change the Cigna percentage from 4 to a 1%.
Yes, ma'am.
Yes, Commissioner Frazier.
Just like to point out the typo in the word shield just before that.
Okay, Shield, SHIELD. It's misspelled on item B1. Okay. Anything else, Commissioners? All right. Is there a motion to approve the agenda as amended?
Yes, ma'am.
Aaron Frazier, thank you. Jason Clausen, will you still second it as amended? Okay. Any other comments or questions on the agenda? Let's vote on approval of the agenda.
I apologize. For some reason, it's not going to
It's
pick up.
okay, just go ahead and voice vote, you can still
Yes.
work on it, okay?
Yes.
All right, thank you, the agenda has been approved. At this time, we will have prayer and pledge of allegiance. The prayer is going to be led by Commissioner Donnie Cable, and the pledge of allegiance is going to be led by Commissioner Jason Clausen.
Let us pray. Gracious Heavenly Father, we come together here as commissioners and leaders of this county and the citizens of this county. We thank you, Lord, for the opportunity we have to come together. We ask this evening as we proceed making decisions that our decisions will be based on truth, based on things that is necessary to make sure that this county continues to move forward in a progressive way. We ask your blessings upon all the commissioners and leaders that are here. We pray now, Lord, that you would be with our country. We know that we have issues with our country, but we pray that those issues will continue to be improved. And Lord, this evening, we pray for those that are still being affected by the hurricane. And we pray, Lord, that you'll be with them as they progress through improvements of their life and their homes. And we thank you, Lord, for all the help that our county has received from outside of this state. And we thank you, Lord, for the many blessings you have bestowed upon us as we continue our life here on this earth. We ask all of this in the name of the Son, Jesus Christ. Amen.
Amen.
Salute, pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item number 7, it's always for us to recognize our elected and appointed officials. So if you all would please stand at this time. Thank you. And newly written, item 7B is the appointment of a 7th District Commissioner. We have the application of a person in our packets. The floor is open. If you all would rather, we can let that person speak a little bit. You all can ask questions or just listen. Would you like that?
Yes.
Okay, Ms. Carol Whaley, if you would like to come into the arena, you may say a few words to us.
Thank you. I apologize for being slow, but I had knee replacement a couple weeks ago, so just rolling along. My name is Carol Bailey, and I had submitted my application for the vacant commission seat in the 7th district. I've got over 14 years in banking experience and over 26 and a half years as the collection specialist in the finance department at the city of Johnson City. I would appreciate your consideration for commissioner, and I look forward to serving. For what you do.
If you want to wait just 1 second, let's see if anybody has a question. Okay, so you may be seated. Thank you so much. The floor is open for nomination. Aaron Frazier.
I make the nomination for Carol Whaley for 7th District seat, ma'am.
Second.
Okay. So we have a motion. I think we just need a nomination. So we have a nomination.
And I'll add at the end that the nomination cease and we elect by acclamation.
Okay. So that is a motion. Is there a second?
Here. Second.
Okay, Steve Burrow on the second. Yeah, so Aaron amended what he said to be a motion to cease nominations and elect by acclamation, and Steve Burrow seconded that. So we'll get the records changed to reflect that. Any questions or comments?
I'll make one comment. Carol reached out and actually has called some of us and asked questions and has been very interested in what we do. And I have been impressed with her interest and her desire to serve. And I just wanted to let you know that. And Jason can testify to that too.
Absolutely.
Julian, do you need to change the screen before we vote? Thank you. Well, it needs to say the motion was made by Aaron Frazier and the second came from Steve Burrow, please. All right, now it reads as presented. Any other words before we vote? All right, let's vote on the appointment of Carol Whaley to the 7th District vacancy. Jerry. Okay. All right, so motion passes. Ms. Whaley, would you like to be sworn in?
instead of her
Would you
coming
be
here.
willing to go to her? Okay, thank you. That'll allow
I hate to be a pain.
anybody in the audience to get a better picture too.
Madam Chair, thank you. I apologize for getting her to sit down before the vote, but I didn't want her to go sit down out there and then come back in since she was the only one, so.
That was a wise decision. Thank you, Ms. Hughes.
I got faggot, man.
Constitution of the United States of America and state of Tennessee, faithfully and honestly discharge the duties of the office of county commissioner to the best of your skills and ability. And you will faithfully demean yourself as such and perform the duties of your office, which you do in your lifetime, so help you God.
Thank you.
Thank you, County Clerk Mary Gooch, for swearing her in, and Carol Whaley, we welcome you aboard. That brings us to item 8, which is a look at the April 21st minutes. We'll take them one at a time, so just April 21st right now. Todd Smith makes a motion to approve the minutes from April 21st, and Cody seconds that motion. Commissioners, do you have any corrections, additions, deletions? If not, let's vote on the approval of the April 21st minutes.
Carol Whaley.
Yes,
And Ms. Whaley, we'll have to do that all night long.
okay, that'll be fine.
The next time we meet, you should have all of your electronics set up.
Lisa Childers.
Yes.
All right, motion passes. Now let's look at the May 1st special call meeting minutes. There's a motion from Charlene Thomas and Donnie Cable to second that motion. Any corrections needed on this document? All right, let's vote on approval of the minutes for May 1st.
Jerry Crawford. Lisa Childers.
Yes.
Carol Whaley.
Yes.
Okay, those meeting minutes are approved with one abstention. Item number 9, the clerk's office will read those seeking notaries and bonds.
Julie Ann Williams, Laura S. Nelson, Farrell, Lisa Lyons, Angela Walsh, Louis Carty, Sky Roadback, Joyce Pope Birchfield, Judy Carver DeRoe, Richard Brown, James C. Miller.
Is there a motion to approve these? Gary Kemp, seconded by Leslie Hughes. Let's vote on under using bylaws.
Children,
Yes.
Carol Whaley,
Yes.
Motion passes with one abstention. So we move to item 10, which has been amended. This will now be the May oral report from Mayor Patty Whitby.
What we're going to do this evening, as you've seen, this will be our third year of recognizing the middle college graduates, and now we have a larger number of TCAT dual enrollment graduates that I want to recognize tonight. But first, for some of the newer commissioners who may not be as versed in this program and how very exciting and important it is to Carter County, I want to go over some of the stats with the middle college program and how successful it has been for the students that are coming out and what this program is doing for these kiddos. Over the course of 2 years, middle college students complete 20 college courses, earn 62 college credits, and graduate with an Associate of Science degree along with their high school diploma. The program began in 2021, and this marks the third graduating class, which includes 21 students. We are the largest middle college program east of Chattanooga. In Northeast Tennessee, we are the largest, even when compared to programs in Bristol City, Kingsport City, Sullivan County, Elizabethton, and Greenville City. The graduating class received a combined total of $218,000 in state and federal grants to support their education. Nationally, only 13% of students who start at community college earn an associate's degree in 2 years. In our program, 85% do. 100% of our graduates have been accepted into ETSU's honors program. The average grade earned by this year's graduates across all college courses was an impressive 91%. Looking ahead, 30 rising seniors are expected to graduate next year. And we are excited to welcome 45 rising juniors into the program in the upcoming year from Carter County School System. That's a little bit about the middle college program. We also have the TCAT dual enrollment program that has gained wide success and has become very popular. Last year, we remember we only recognized a handful of students. This year, we have several. A little bit about that program. Over 1,500 high school students enrolled at TCAT dual enrollment courses from across the 5-county service area. Students participated in over 20 career and technical education CTE programs. More than 200 students qualified for technical certificates or diplomas, including these outstanding Carter County students that we will recognize tonight. Carter County students especially excelled in meat processing, off-road diesel, and welding. First of all, I want to recognize one of the architects of the middle college program who has supported these children since its induction. I'd like to have Drew Gray please come up. Drew has been with these students since the very induction of this program, and they've worked all the kinks, and he's been right by their side. So he just deserves a warm round of applause for what he's done for this. Next, we've got some special guests here with us tonight that's going to help me hand out these little plaques that we've got from the county. I'd like to bring up President Dr. Jeff McCord, President Heath McMillan from TCAT, and Dr. Brandon Carpenter, Carter County Schools. Oh, sorry, Jeff. Jeff is the president of Northeast State. We're going to start with Cloudland High School, and we're going to recognize the middle college graduates. And these children, and these kids, I should say young adults, have already received their high school diploma and their Northeast State Associate's degree. So these guys have really worked hard, and they're getting ready to either continue their education or they're going into the workforce. So with that being said, we'll start calling those up. Isabella Jarrett.
You're gonna be graduating again. Mackenzie Morrow. Camden Peppers. Of course. Smile. He's gonna get you a picture. Ian Powell. Does anybody know who this young man is right here? This is our highway superintendent, Jonathan Powell's son. So Jonathan, congratulations on this remarkable gift. Some of them are on vacation or not able to attend tonight. The next ones are from Hampton High School, so we'll start there. And as you know, this group of kids was displaced and had a little bit of a rough year, and they still excelled. So we're super proud of them. So, Caitlin Campbell, Hope Conover, Riley Davis, Austin Duggar, Anna Hatley, Piper Helly, Aiden Lambert, little boy, congratulations. Good one, congratulations. Abby Lunsford, Bailey Moss, Seth Branshaw. We'll start with Happy Valley next. Carabeth Crisson.
Some of these kids are at the state track.
State track meet. Zachary LaRoche.
Way to go, Zachary.
Abigail Hyman. Jalen Largent. Thank you all. We had a typo on her name, so we've got to fix it. Stephen Pierce. Haley Sexton. Congratulations, Haley. You're welcome. So the next group, this is the TCAT dual enrollment. If you remember, we did this last year and had 8. We now have how many, 20? 24. That's how this has grown. So this is pretty exciting. Colin Davis. This is Cloudland. Colin Davis. Matthew Baker. Andrew. Oh, is it Colander or Calendar? Colander. Kingston Cole. Harley Hamby. Noah Young. That was into Cloudland, so we're moving into Hampton now. Tyler Bowers. Mariska Clemens. Serenity Garland.
Mayor Woodby, I think all these kids went to work.
Yeah. Bryson Montgomery. Loki Osborne. We ought to surely get one out of this group. This is a big deal. Jaden Wallen.
We think they went to the beach.
Now we're going to Happy Valley. At least gives you an idea of how many kids are coming from each school. Emily Vanover. Caleb Falk. Dylan McKeon. I hope they're all working. That's even better. Is this Unaka? This is Unaka. Madison Barish. Caleb Burdick. Oh, I thought we had one. Brian. Theodore Elliott. Autumn Sheffield. Elijah Steins. Caitlin Edwards. And Zachary Elrod. I want to support the education behind Carter County because this is the future of Carter County. This is the workforce, and these programs are really a game changer for Carter County. I'll let each one of these guys say a little something about the programs if they want, or if you have any questions.
Really quickly, so we have a lot of Carter County students, but I can tell the students in this program, because they have cords on when they come across, you should be proud. You've got a lot of great people. They have done extraordinarily well academically, and they know how to shake your hand. Do things, they're gonna go a long way. So congratulations and way to go for you as well.
Well, I just want to say thank you to Carter County School Partnership. We're really proud of the students and what they've accomplished so far. And we look forward to this long-term partnership. And I appreciate you, Mayor, and the County Commission for recognizing the hard work.
Well, thank you all. And I've just got a couple of appointments and then I'll be finished. So one digital come up. I've got to do an appointment for, let's see, the Equalization Board. So I'll just read these into record. I think you guys have a copy of them. So this will be an appointment for the Equalization Board. Whereas in Tennessee, General Assembly has created a uniform general law of statewide application regarding the creation and operation of county boards of equalization codified at Tennessee Code Annotated, Title 6, Chapter 1, Part 4. Whereas pursuant to Tennessee Code Annotated, the county legislative body of each county shall, at the April session of each year from different sections of the county elect for a term of 2 years, 5 freeholders and taxpayers who shall constitute a county board of equalization. However, the county mayor shall fill such vacancies as the vacancies occur. Whereas the county mayor has been notified that a vacancy currently exists on the Carter County Board of Equalization to be filled pursuant to the statutory scheme detailed herein until the next regular appointments are made by the county legislative body. Now therefore, I, Mayor Patty Whitby, by virtue of authority invested in me by the laws of the state of Tennessee, do hereby issue this order pursuant to Tennessee Code annotated 67-1401, officially appointing Spencer Campbell to fill the current vacancy on the Carter County Board of Equalization to serve until the next regular appointments are made by the county legislative body in April of 2026. The next appointment is a vacancy on the Cyan Utility District. They had a board member that did resign, so we're going to appoint into that one. Whereas the Tennessee State Legislature has created a uniform general law of statewide application for selecting utility district commissioners codified in the Tennessee Code annotated 782-307. Whereas pursuant to said statute, vacancies on the Board of Commissioners of single county utility districts shall be filled by appointment of the county mayor. And whereas within 60 days after the occurrence of a vacancy in the office of any commissioner caused by death, resignation, disability, or forfeiture of office, and no later than 30 days prior to the expiration of the term of office of any incumbent commissioner, the Board of Commissioners or its remaining members shall select 3 nominees to fill such office in full accordance with any residential requirements that may apply to the office vacated or to be vacated. And under the seal of the Board of Commissioners shall certify such list of nominees in order of preference recommended by such commissioners to the county mayor. Whereas the county mayor may enter an order either appointing one of the nominees or rejecting the entire list, and in any order either appointing or rejecting the list of nominees shall be entered a record on the minutes of the county legislative body, and a certified copy of the order shall be furnished to the Board of Commissioners and to the appointee. And whereas the Board of Commissioners for the Cyan Utility District submitted a list of nominees to fill a vacancy on the board resulting from the expiration of a commissioner's term. And now therefore, I, Mayor Patty Whitby, having reviewed the certified list submitted by the Board of Commissioners for the Cyan Utility District, and by virtue of the authority vested in me by the laws of the great state of Tennessee, do hereby issue this order pursuant to Tennessee Code annotated, officially appointing Jeff Blanton to the Board of Commissioners of the Cyan Utility for a full term of 4 years, effective May 19th, 2025. And that's it, unless you guys have any questions for me. Thank you.
Thank you, Mayor. Okay, so at this time, I'm gonna allow Commissioner and Financial Management Chairman Brad Johnson to come forward to begin the insurance presentation. He will invite the members of One Digital forward at the right time. Thank you.
Thank you, Madam Chair. Welcome, Ms. Whaley. Last person only last one meeting, or I don't know what.
I'll see if I can do better than that.
That's great. Another thing, it's good to see another human using the walking device. I use a cane, have you know where that's under my table. I do a nose dive before it's over with.
Let's hope not.
Right.
I'll get you.
Gets me right. Before we get started into the presentation, I just wanted to just briefly go over the setting from the financial management, which consists of our director of schools, our superintendent of schools, our mayor, and Commissioner Stout, myself, Commissioner Dr. Haycuff, and Commissioner Deal. A great panel. Every year around the April timeframe, we go into the preliminary of our budget hearings. It's also a time when we have to examine our insurance for our employees and their benefits. I can say, and it is proven fact, and it is documented, that our county has the best of benefits and insurance in the other region of the state of Tennessee. And it's the reason because of the responsibility of you commissioners and from the FMC for the review. This year was completely different what it's been for the prior 4 years. Everybody is quite aware of the national problems that we have had, epidemic coming in, going out of the epidemic, what it has cost medically. And now we're seeing just a little change, and it's from the federal level, the upper echelon, and its cabinets. They're looking at decreasing costs, particularly on RX or your drugs. For me, in my opinion, in the past 2 years have choked us. We have had increases of 8 to 13% each year. And if you think the insurance here in this county is equal to $2.1 million each budget year. So every penny that we can save, we do. And with teamwork of each of us on the FMC, but particularly to our broker and their firm, unbelievable the work that has been placed in. At the beginning of our budget year, we were advised by our broker, Mr. Tim Hilton, which I'll introduce in a minute, that we should lock in 18% with the funds, 18% for our estimating for our budget for this upcoming year. Well, just think, we're in the middle of a disaster. We're in recovery mode. And that means we have to watch every spare penny that we can conceivably possibly make it. Because we have employees we have to take care of. We did not, and we do not reduce our benefits whatsoever. We are extremely competitive, not only in our benefits of the insurance, but also of our wages. We're not the highest. We're far from the lowest, but we are competitive with everybody around us, all the 9 counties. But they all know that our benefits, some of them don't know how to count how much a benefit is worth to them until they get confronted with it. But with the 18%, all of our office holders and everything is estimated into their budget proposal. Now, with what will be presented to you, I'm going to introduce the company of One Digital, which was known primarily, or first, we dealt with them as Sequoia Group. Same people, different names, same smile. But let me tell you about this. They started the call in February to start gathering information. From February until even after, if you'll notice on the agenda, I had to make a correction on the thing. They were even working after this was printed for the benefits of this county. They have represented this county and its employees impeccable. It's unbelievable, the work that they put in. It's not one of those where you have a broker that you may contact once a month and they'll call maybe one of the elected officials. Maybe the finance director is on the phone call practically every day with either the broker or the staff of his firm, and has provided unbelievable amount of recommendations and services to this county, often without any compensation whatsoever. I receive on the average about 4 calls every week. Ms. Carolyn, our finance director, every day. Dr. A. Cuff, Commissioner Deal, Commissioner Stout, all of us are always being brought up to speed, very transparent in anything that goes on, and is proud at the results they have brought to us. This year, if you will, if you look in your package, and it will help you as they go along with their presentation. In case you didn't read it, this is what it looks like. It's in your folder, and it helps as they make a presentation that you can watch the numbers and get a good feel of what each one of those represent and some of the benefits and all that to be explained. At this time, I'm going to introduce our presenter and the staff. And that is Mr. Tim Hilton, the principal of One Digital. Aaron is a Christian, correct? Okay. Colton, Burwell, and with all these thorns, I'm gonna rose. And the Cigna Healthcare person from the precinct, Tanner, welcome so much. And if you, this time, I'll turn it over to you, and you can make your presentation at your conclusion. I have a motion to put before the call, Madam Chair. Now, I'll get your
Thank you, Commissioner Johnson and Madam Chair and Commission. Thank you all so much for allowing us to be here tonight. We take it as an honor to be here. Just because this is business doesn't mean it's not personal. The county and the employees and the taxpayers are like family to us. So when we received that 18% increase from Blue Cross Blue Shield, we took it as a slap in the face with what we were faced with back in September, and then in February, March, or April when we received it. My staff or my team there, Colton and Aaron, we take it a privilege to be able to present to you tonight what we are bringing to this commission here for you all to vote. And what we bring to you all on an annual basis is to give you options. And praise the Lord, we had options this time. Okay, if you look on your page there on page 2, and I'm just going to kind of give you the highlights here. We've been with Blue Cross Blue Shield for many, many years. And Blue Cross Blue Shield is one of the finest premier carriers in the state. And so is Cigna and a lot of the other carriers. So if you look at it, Blue Cross Blue Shield's initial renewal was 18%. And they said, let us know if we don't, if what we can do or where we need to be if you don't shop it. Didn't respond. Aaron didn't respond. And it came to 12%. They said that was as low as they could go. And then we shopped it out. Lo and behold, we shopped it out to United Healthcare, Aetna, another TPA, and then also Cigna. United Healthcare was not competitive. The TPA was not competitive. Cigna was. The net effect of it was Blue Cross Blue Shield, after being at 18 and 12, and then 8, and like last Thursday or Friday, they came to 5. Well, why didn't they get to 5 to begin with? Okay, we have to protect the penny, and we have to protect the paycheck of the employees. We don't have disposable pennies, and we don't have disposable paychecks. Okay, so and then Cigna came in at 4%. I mean at 4%, and then they adjusted their rates down to 1% with a 12% rate cap for next year at 2026 renewal. So we're holding a 1% over current, no benefit changes in regards to deductibles and out-of-pocket maxes, except for just a little bit of change there because of the federal guidelines. And so the dental has a rate hold with Delta. The vision has a rate hold with Blue Cross Blue Shield. We'll talk about that. Do we stay with Blue Cross Blue Shield on the vision, or do we move to Cigna, or what do we do there? And then the disability and all the ancillary products were no change. No change means no increase. We all know about the groceries and the gas and everything else. We take a lot of pride in not passing on any rate hikes on anything. So at this time, I'm going to ask Aaron to come up. He'll get into the details, and then we'll bring up Teresa Tanner, our Cigna rep. I've been working with Teresa for 10 or 12 years. Aaron, I've been working with him for 2.5. Colton and I go back 7.5 years for the initial team up here that was Sequoia Group, and now is One Digital. Okay, so Aaron, if you want to come on up. Any questions so far? Anything?
So Tim did a great job of laying it out there. We told as a budget, you start at 18%. We had a pretty good estimate there because that's what Blue Cross started out with. So we dropped that down. So moving on to the next page is showing the grids. So you might already be looking at there on the left, the 3 plans. We have 3 plans here. So you have 3 columns on the left, 3 columns on the right. I know it's black and white, so it's a little bit harder to see, but there is a difference between the two. For current rates on the 3 plans on the left, and that is the final offer with Blue Cross on the right. Now, that is a 5% total increase. That's the total amount of money, like Commissioner Johnson mentioned, a little over $2 million. Well, you'll notice that each plan has its own separate increase, okay? So Plan 1 is 3.6%, Plan 2, 6.63, Plan 3, 8.48%. So that's all blended to be a 5% total increase on those options. Thankfully, the plan with the most enrollment, Plan 1, is what would be increasing the least. But that's keeping all your benefits the same. That's staying with Blue Cross. Now, Blue Cross has offered a rate cap, okay? And that's on your next page, and those are the terms that they've laid out for their rate cap. It's a little different than the Cigna rate cap, which Teresa will talk about here a little bit later. Blue Cross's rate cap is based on a medical loss ratio. Okay, so the medical loss ratio is this. Total claims paid out for the year divided by your total premium paid in. That's how Blue Cross measures, or how all the health carriers measure where you're at and how you're performing as a client. Okay, so they're saying that they will give us a 12% rate cap guarantee if the medical loss ratio is less than 100%. If it's over that, who knows? They could give us 18% again. The math from Blue Cross, they gave us 18%, but the math said 26. Okay, they knew we were going to take 26, so they started at 18, and of course, like Tim said, dog and pony show, getting down to 5. So last year, 2024, medical loss ratio was 97.2. Year before that, 104.8. And it's been about like that for the last 6 or 7 years, where you're just under or just over. Okay, so we're taking a bit of a gamble here with this guarantee. I'm going to pause right there. Any questions on Blue Cross and what they've offered? All right. So obviously, they also have some caveats. All carriers do this. If the enrollment changes up or down by 15% or more, they can consider that this guarantee be invalid. That's pretty typical. So you'll see that there on the first bullet point, or termination or addition of subsidiary operation or class of employees. So that's a big one there. If for whatever reason we just completely remove a specific department off the plan, then this no longer applies. So certain major things like that, you'll notice there in the bullet points, can void the guarantee. But I don't think any of those are really something that we need to consider unless there's something here that I don't know about. But just keep those in mind with taking in consideration the guarantee. So moving on to your next page, page 5. This is where we're comparing Blue Cross's final offer, which came Wednesday of last week, with Cigna's offer, okay? So Cigna is offering 1% total. It's actually a little bit less, 0.91%, with a 12% rate cap. So most of the people are on plan option 1. And if you'll notice right there, plan option 1, if you compare the prices with Cigna and Blue Cross, it's less. So even though it's a 0.91% increase overall, for most of the people, the rates are going down. Okay, we've got a total of 145 people on plan option 1. So for the bulk of the enrollment, that's a lower price, and we got that 12% rate cap guarantee with them. So going on to page, or so I'll stop right there. Any questions on just the financials, just the financial part for Cigna versus Blue Cross? We'll talk about coverage considerations here in just a little bit. So on slide 6, these are the terms and conditions for Cigna's rate cap. Okay, Teresa, feel free to jump in if I misspeak or anything. This is copied directly from the sheet. The finance committee has a copy of the full document. But basically, this is saying the same thing. Bullet point number 1, change in enrollment up or down 50%. Obviously, that's full weight right there. Okay, right there. Bullet point number 2, Cigna Healthcare. If there is a claim that exceeds $500,000, even if the claims don't meet the plan year, but it's going to project that way. I might need your explanation there a little bit on that, Teresa. The claims over $500,000 going to project around renewal time, yes?
Right, that's
over
correct.
500.
So if there's already a member that's already exceeded 500,000, or let's say there's a member that's been diagnosed or a car wreck or something that this member's going to hit over 500. And then the rate cap becomes null and void. So that's really the only caveat that's within our rate cap guarantee letter.
And Tim, how many of those we had in the last 3 years? I couldn't find any either. So unless there's something I don't know about, Tim and I couldn't find any of that. So in the last 3 years, you would not have, that bullet point would not have applied. okay? So, number 3, changes to the benefits of the plan, that's pretty obvious. You change the material benefits of the plan, the price is gonna change. We can't guarantee the rate cap because you've changed the benefits. The 4th one down right there, this plan is actually level funded, okay? So we actually get access to a little bit more data than we do, because currently you're fully insured. Blue Cross holds a lot of that data. They do give us quite a bit because you're over 200 employees. They have thresholds on what info they're gonna provide. But we can get a little bit more claims data here being level funded, because technically it's filed with the state as a self-funded plan, but Cigna purchases all the reinsurance on the back end, okay, to make it level funded and reduce the county's liability. Okay, there is no deficit that you have to pay back if your claims are higher at the end of the year. Okay, so that's how level funded works. But you have the opportunity for a refund if the claims are good. Okay, so if the claims are below an expected level, you split that refund with Cigna. All right, so we have an opportunity to make some money back here. Also, we're getting that additional claims data, but all that bullet point is saying, because it's level funded, there's different taxes involved with level funded and self-funded plans. And if there is this change in state or federal law, it could, probably not, but it could nullify the rate guarantee here. And you see the last 2 bullet points again, talking about federal taxes or state plans. And on the last one, any commissions amounts, obviously we're going to change that. We're not going to be griping about any commissions involved with that. So that bullet point is not going to apply either. So any questions on these bullet points here? Rate guarantee.
Aaron, I have a question for Teresa. Teresa, in regards to that 12%, being add to a $500,000 claim, in your tenure since you've been offering that, how many times has that been applied?
I don't see it very often, okay? And remember, it's a rate cap.
Yeah.
So if you actually run better than the 12%, then you have an opportunity to be lower, okay, than the 12%. But that's a caveat to protect us in case there is a large ongoing claimant that emerges, just to protect Cigna, because then I'm going to be $1 million claimant or higher. So, but it's very rare that that's going to undo the rate cap that we have available. The other thing I'll add is One Digital has been a great partner for Cigna, and I appreciate you pointing that out, Mr. Johnson. We want to work closely not only with Carter County, but we work closely with One Digital, and they're a wonderful partner. So our goal is to hopefully, with this offer that we put on the table, not only write you this year as a client and serve the members of Carter County, but for many years. We know that nobody likes disruption, and so that's why we offered the rate cap guarantee out there, to give you a 2-year, at least 2 years, where hey, we don't have to worry about making a move. But worst case scenario, next year, if we budget 12, we should be fine. But what you want to keep in mind is you may budget 12, but you can always do benefit buy downs. Okay, if you say, you know what, we need to push this down some, we can look at options at that time to bring it down. And one other thing I'll point out is, because of the type of funding that we're offering, Tim and his team are going to have full access to reporting. So they're going to know on a monthly basis how you're running, and that way there's no surprises. They don't see the individual claims, so they don't know that, but they know on an aggregate basis how the Carter County's claims pool is running, and therefore they can report back and let you know, hey, it looks like you are going to be getting a very good renewal, lower than the 12%, and there's opportunity for a surplus share back. So I know it was more than what you asked.
No, you're good. You're good. You're good. I'm just stirring the pot.
So like I said, we'll get to coverage particulars here in just a second, but as far as the financials go, any questions? Okay, slide 7 is just showing our due diligence there. You got a quote from United Healthcare. You see that on the right. That's at a total of 7.15%. The cost increase is too great on options, and options too. So that's pretty much what knocked them out of contention. But we want to make sure to let you know, just like Tim said, we're not just checking 2 carriers and calling it good. We're checking all options that we can for the county employees.
If I might add there, again, all this information, all the quoting out and everything will go back to Finance Director Carolyn Watson, and she'll have that for the comptrollers or the auditors if they should come in and look at it, that she'll have that in her file.
So moving on to slide 8, this shows the differences in the material benefits of the plans, okay, between Blue Cross and Cigna. We're matching up deductibles, we're matching up out-of-pockets, those are the same. Getting down to the nitty gritty here, there are a few differences and we want to point them out. So primary care and office visit copays are the same, $20 and $40, okay? No difference there. Your telemedicine though, right now, if you call up Blue Cross, you call Teladoc, it's $20 for the call. Well, with Cigna, it'll be $5. Okay, so we're saving money there on the telemedicine visit. Urgent care is $40. Now, it was 20/40 with Blue Cross, but there were very, very, very few urgent care providers that were actually only charging $20 in the area. Most of the time, it's the $40 cost anyways. Don't think we're gonna see a whole lot of disruption there, or a lot of issues. $40 is matching up on the urgent care copay with Cigna. One thing that we'll talk about here, the formulary with Cigna is what's called 90 Now Walgreens. And what that means is you can get your 90-day supply at Walgreens and a few other pharmacies, okay? So it's not just mail order. So if you're currently getting 90-day supply on some of your drugs, you can now get those at retail locations. And that list is actually provided here in your packet. You can look at that later there. But any pharmacy, and these are all retail chains. We've already checked other ones like Roan Mountain Drugs, that's in network. But anyone that has a 90 next to it, you can get your 90-day fill right there in the store with Cigna. Okay. Obviously, you can use the mail order program with Cigna if you prefer that, or you just don't want to go into town. That's fine. You've already got that laid out, but you do have that option to get the 90 days supply there at the store. Drug copays are exactly the same, 10, 30, 50 on tier 1, tier 2, and tier 3 drugs. That's how it is with Blue Cross right now. That's how it'll be with Cigna. And then your specialty drugs, $100 copay. Big difference though is your preventive medications. Right now, your preventive medications are still falling under those copays, 10, 30, 50, all right, with Blue Cross. Well, if you look at the preventive medication program list right here,
And that's for the HSA qualified plans, right?
yeah. So if you're on the HSA plans, 2 or 3, all of these drugs on this list, $0. You're currently paying a copay for them right now. They're free. Okay, this is a lot of drugs on the list. And that's pretty standard with the plan offerings right now with Cigna. That's not anything extra special. That's just for Carter County. So you know that system is already in place. And then once we get signed up and effective July 1st, you'll be able to get those. So that's the big thing there. Just small minor tweaks in the benefits, but I think most of them are positive. So I'm going to pause right there just for the benefits. Any questions?
One thing I wanted to add, Aaron,
Yes.
I just realized it. So Cigna owns MD Live, which is the telehealth for care providers throughout the country. We actually purchased them several years ago. So on the copay plan for MD Live, whether it's PCP or urgent care, that will actually, I see where I put $5, but actually I will always update that to be $0. Okay? Because we want to encourage employees to use MD Live, whether you're here in Parktown or anywhere in the country. You need to access a primary care doctor or urgent care. I'll give my husband as an example. He had a skin rash on his upper thigh. He's like, Teresa, I don't know what this is. He was down in Florida somewhere. And I said, you know what? By the time you try to get him to see a doctor somewhere, and they line you up to get in, and it might be 3 days later. Let's just call MD Live. Call Cigna 1-800, get MD Live. He did that. It took him about 20 minutes. He called me back and said, well, I got ringworm like that. And I said, well, did they call you in a prescription somewhere? And he said, yep, sure did. So, and it cost him $0. So we want to encourage our members and our family members to use MD Live. It's $0 cost. And what we know at Cigna, if you encourage that, overall, it lowers your claims. And if you lower your claims, you're going to lower the cost to the county. So I want to put that up. Urgent care and primary care on the copay plan covered at 100%. They still have MD Live on the 2 HSA plans too. We can't cover those at 100%, but we still want to encourage them to use those because our negotiated fee that we have behind the scenes is usually about $55 to $75 when they call in. So it's still lower than going to a provider, and it's so much quicker. Okay? And they can write prescriptions, whether you get sore throat, you get earaches, whatever it may be. Really encourage that.
One of the things I may add here, one of the things that we've talked about in financial management committee, and Blue Cross Blue Shield talked to us about it through the years, and we communicated it to FMC, is that our employees are not taking advantage of the freebies. Okay, if you don't take care of the freebies, it costs you on the backside, just like Teresa said there. So one of our communications, that Chairman Johnson has spoken to us about, is that we got to get this communication out to the employees so they understand that. We are a collective group here with our base, and we're only as good as the next person beside us to keep these rates down. It takes a collective effort here. So we got to take care of this.
And we'll try to do our best to push those collaterals out so you can make sure members get a hold of that. One program that we really like is our diabetes prevention program. So a lot of folks are walking around pre-diabetic and they don't even realize it. So if we can prevent them from getting diabetes, that's going to help lower their costs. They're going to be healthier. And so we have a program called Amada, and it's free, it's included. And basically what we want to do is encourage anybody that's, that is overweight, has a certain waist size, certain glucose levels that we know are making them pre-diabetic, to enroll in the program. It's voluntary, but we're going to encourage them. They'll have a coach to work with them, help get them healthier so they can become diabetic. So if you can stop the disease before it actually happens, again, that help. You have more productive members and employees, but you also have lower costs.
We need to prevent the heart attacks, the strokes, things like that that happen, those $200,000-$300,000 claims. You can prevent that 2-3 years in advance just by doing that stuff here.
Okay, here's another thing also. We know that some of our families, they have to decide whether they're going to fill a prescription or they're going to buy groceries. This preventative free generic program here for the employees that are on that HSA plan. Ozempic is sitting there free of charge.
There's a lot of good drugs on there that we.
If they have diabetes and they're on Ozempic, then it's free of charge. Now think about that for a second. Okay. Drugs or food or shoes.
We want to encourage members to try to stay healthy. So this is have a condition, and all it means is access to that drug to prevent heart attacks, strokes. We want to encourage them to take those drugs.
So keep in mind, they still have to have a type 2 diabetes diagnosis.
Yeah.
It's not free Ozempic everywhere, okay? So you still have to qualify. But just keep in mind, like, as long as they're, you have it, then you'll get that. Any other questions on benefits? Okay. So looking on there to page 9, this is just some sample language that you would include in the letter. So, we're talking about the preventive medications, get your preventive visits done. So this is the sample language that we provided that you can include going out to employees for open enrollment coming up soon. Just letting them know that, hey, we're starting this new initiative. Get your preventive screenings. We've secured an outside vendor to help manage this. So that way, nobody here in Carter County, none of the admin staff know who's doing it and who's not. Okay, we're just getting a report from this vendor, who's compliant, who's not. And the idea is get your preventive screenings done. And if you don't, you're gonna have to pay more for your premiums next year. Okay, that's what it is. Do you have anything to add on that, Carolyn? Okay. So letting them know up front. So the way this would work is, we give them notice right here, July 1st. We want to give them 10 months to make sure that they have plenty of time, 9 to 10 months. It's up to y'all. We can decide. We can pick whatever program length that we want. But you give everybody plenty of time to get their screenings done and turned in. The vendor can compile them and provide us the report. So that way it's ready for deductions for 7/1/2026. Okay, so we don't want to get caught off guard or stuck in the middle of June trying to figure out who's paying more and who's paying less. But it'll be clearly communicated to everybody, get this done. This is your date that you have to have it submitted by. Here's who you need to submit it to. It's very simple. It's just the coding that's used. The doctor's office can send it in or the employee can send it in. You send it into them, they verify it, that's it. Okay.
One thing I want to add, Aaron, we can provide you with that report too. So Cigna behind the scenes, we're tracking every member that's getting their well man, well woman, their preventive exams. And so what visual wants us a full report from our effective date whatever date.
Right.
We could pull that and say, here you go, here's the, I don't know, we give you the names.
That's the thing.
No, we can, because of
Well-
one of the programs we have, yep, so.
And I'm not sure if we qualify for that because of level funding. So the reason why we hadn't done that in the past, because yes, I can see how many have taken their presented visits with Blue Cross.
Can you get that qualified for us?
Yeah, let me find out. Yeah, because because we do have a program where we track that, we know, but I'm not
You gotta
sure
buy
we
into
can
that.
tell you who.
Yeah, so the reason why we've looked at this outside vendor is because, yes, I can see how many preventive visits have done with Blue Cross. I can pull that report. And I've done that with Cigna as well, but I can't see who all's done it, also their spouses. Okay, we're tracking employees and spouses in this. We don't have a lot of spouses covered in the plan, so it's really only a handful. But we're tracking both of them because they're part of the claims as well. Okay, so that's what the vendor does, and you'll see there on the next page, page 10. They've priced this out here for 234 employees, $4.47 per month. And so they're tracking that, they're providing us the report, each and every person and their spouse, who's compliant and who's not. You know what, if it does end up to where we do get that capability, or we get to enhance that with Cigna, or Cigna is gonna offer the same benefit for, or the same program for a little bit less, if that's an add-on, we don't have to keep them next year. Okay, but this is somebody we've used in the past. It's very simple. We have the very base level offering that they have on the tracking, and you see all that that's included. With the tracking there, there's some additional options if you want to, talking about challenges and gamifying the whole process. For an extra 56 cents per person per month, I'm not sure if it's completely worth it, especially since we're just starting. But there's ways we can go with this. This is a great start. And there's ways we can go from here to really pinpoint on what we need to do moving forward. So talked about the drugs, talked about the pharmacies. What you also included in your packet was the health improvement fund. It says an investment in your health there on the top. Is that? I emailed that to Mr. Jonathan. Anyways, you're gonna get a health improvement fund. Teresa, what did we land on last week?
$8,000.
$8,000, the health improvement fund that will be provided to Carter County. That is separate from the premiums and the benefits and everything else. And the health improvement fund can be used to pay over premiums. It can be used for, providing a wellness day for everybody. There's a lot of different things you can do with the funds. And if you don't have the flyer, there's a bunch of different options there. HEPA filters for certain locations if you do that. This is examples. Make sure to get that info to you all if you don't have that out. But the nice thing is that Cigna's including that, and that's not tied to any specific performance or anything else with the plan or the proposal.
So that fund will sit over at Cigna, and then as y'all employ any type of wellness initiatives that you want to push out to the members and to the employees, you can do it to employees and their families. Most city county governments will just do the employees because they want to say, hey, we want to maximize that fund. But for example, if you have like some type of challenge, or if you have a, you want to encourage everybody to go get their preventive exams. And you say, we want them all to go and get their preventive exams by a certain date. That's when I can have my people pull the report and tell us who all did. That's why I'm thinking we can do that. So let me find out.
So basically, it's a fund of $8,000, right?
It's a fund for $8,000. It's going to sit at Cigna. And One Digital has a health engagement partner also on their team that works closely with us. So we just say, all right, what do we want to accomplish here for Carter County based on the population needs? So there is a health risk assessment that we could encourage members to go online, employees go online and that gives us a lot of data too. We would give that back to the One Digital team and say, here's what we learned about the population. Here's opportunity for us to push out some programs for coaching. So there's a lot there that's available through mycigna.com, but we can actually push out a program where we furnish health risk assessment, get that data, and then push out a program.
With the fund, you can provide a $20 gift card. Anybody that completes their health risk assessment. That way we have that data, we've got those answers, and they get a $20 gift card. So that's just an example. There's many things we can do. So any questions? Anything else?
Okay.
The county ain't help me.
So we did this.
County application, please. They got one.
We did a disruption report.
Here, like,
99% of providers in the area are also covered under the Cigna. So there shouldn't be any problems with providers. We did the top 50 prescription drugs. Only 6 were considered not covered, but there are plenty of alternatives for those drugs. So as an example, Novolog for diabetes. There's so many other diabetes medications that can be used on that one. Cholesterol, same thing. There's a lot of different alternatives to that as well. So out of the top 50, only 6 instances, but it was really only 4 different drugs.
You did say 99%
of providers
already Cigna's network.
Within, what, 35 miles?
If they were on that disruption report that we did, I believe you pulled the data for the last 2 years, 99% match. That means there was only about there was a 1% fallout. There were 3 chiropractors that were not in network, and there was a few labs that were not in network. So remember, the doctors that are contracted know where this in the lab work, okay? And there was 3 chiropractors. Total 9, so out of hundreds and hundreds of records. So.
Yeah, and I think a couple of them were killing that.
What about ballot? That was good. Cigna and
Ballot, you want to talk
Oh,
about
valid.
that?
So we reached an agreement with them earlier in the year. And so our agreement is good through the end of 2027.
Thank you.
Yeah, all valid facilities in the area in network.
So one of the things that we're very cognizant of, just like all men, everybody in the room knows this, if you move our remote, we don't know what to do. Can you imagine when you start changing from Blue Cross Blue Shield to Cigna? Okay, people don't like change. That's the biggest disruption right there. That'll be the biggest noise. So that disruption report, as Aaron and Teresa was talking about, we're looking at where all our employees went to, okay, over the last 2 years and who was in network. Because you don't want to mess with someone's doctor, okay? And then the next thing you don't want to do is mess with somebody's drugs, okay? If it's not on there, Teresa, if Novolog's not on there, what if they've tried everything and they need Novolog, then what?
So there is a prior authorization process that can happen. So if the member that is on Novolog is said, hey, I've tried everything else, I'm allergic to everything else, then there is a process to get that drug covered for that member. So we just need to go through the prior authorization process. That means that the provider will be working closely with us to provide us with the data of why this person cannot take, why they have to take Novolog, and why there's not an alternative for them. But as Aaron had mentioned, there's it's a there's many diabetic drugs on there.
So there's a lot of communication that has to go out. When you hear the word the words prior authorization or PA, that means they've had a prior authorization with Blue Cross Blue Shield, and they're going to need that prior authorization for Cigna. So if they know they had one before, they'll need one in the future. So if you all decide to vote and go with Cigna, then we need to let those employees know that. So there's a lot of things that we can do over the next month and a half to offset some of the quote unquote noise, some of the disruption. Okay, like filling prescriptions in the month of June, just in case we don't have enough time to get the cards and everything to them for whatever reason. But the biggest thing is to communicate to our most valuable assets, our employees.
Right, and one thing is, since we're so early, we should have everything up and running by July 1st, if y'all vote to go with Cigna. If anyone had a medical procedure that they've already, I'm just telling you guys this so you know, anyone that has a medical procedure that was already approved by Blue Cross Blue Shield, because they're probably working with their doctor right now trying to get medical procedures approved by Blue Cross. If it's going to occur those first 14 days, July 1st through July 14th, Cigna's going to honor that prior authorization. So we'll just take Blue Cross Blue Shield's prior authorization as our prior authorization. So just know that anybody that's going to have a medical procedure that they had to go through a PA with Blue Cross, and if they're going to have that surgery or that hospital stay in the first 14 days, we're going to honor that. We just need a copy of that approval from Blue Cross, okay? The second thing is for the drugs. Usually it's going to be your high-cost drugs that have to go through PA. So I mentioned prior authorization for the Novolog. So even though we said that's not covered, if the member has a reason why they have to have that drug, we can get it covered. They have to go through PA. But all your high-cost specialty drugs and that's usually 4% of the population, are taking one of those high-cost specialty drugs. Those are the members that will have to go through the prior authorization process. So although it's a small number, those are usually your most vulnerable, but also your sickest members also, because they're on the, we want to keep them healthy. So you'll hear from those members. And so what we want to do is, again, let them know that go ahead, work with your physician and get us what we need from the prior authorization process. So once we get the system up and ready, we will be ready to go on July 1st to get the prior authorizations approved. It usually takes us, all the data, about 48 hours.
Again, a lot of that, all that comes from the provider. The provider's got to submit the notes and the lab results from prior tests to satisfy all the check boxes to make sure that's covered.
And that would happen if you made any carrier change. So that's not just
all of them.
just us.
Some of the areas I'll fill you in. Let's see, first before I do that, I want to give the members of FMC an opportunity if there's any questions or any statements you will make before you move on concerning the insurance. What you all have experience, or if there's anything we haven't covered yet. Commissioner Stout, anything you?
Yeah, I'll comment on the same lines that you did. We've been with Sequoia since 2017, and they certainly have stepped up to the plate every time. Prior to that time and switch, our prior broker would show up maybe once a year, visit several elected officials, and then disappear. They have been very cognizant and have done their due diligence with each employee as we have gone forward. I don't expect any change in their attitude or performance if we switch carriers tonight. The other thing that I think is important for us to realize, what you mentioned, and I'll just underscore it again, the drug benefit is huge. The majority of the folks that have looked at that list have told me that the drugs they take are on that list. And that puts money back in their pocket. So it's like giving many of our employees a raise that they didn't expect to get. And I was pleased to hear Teresa comment on how, if they have a reaction to a generic, how they go about obtaining the original compound. By doing that, I think we've protected ourselves and our employees by giving them alternatives at really no cost. So I just want to applaud One Digital again, and thanks, Teresa, for coming up and answering questions. I see this as a win-win for Carter County and particularly for our employees. And it also means that there'll be savings in the long run. Thank you, Chairman.
Thank you, Dr. Echo. Mr. Deal, you have anything you'd like to?
Yeah, just one thing is to thank Tim and his group for the hard work they've put into this to help bring the savings to the county and the employees.
See you guys very good. You're fine, Mayor. Two items that was brought up here that I'm going to elaborate with just about a half a second. One is we're finding out through the past couple of months, one of the biggest problems is communications. What do we have to where you as a commissioner, or any of our department heads can communicate with the individual employee of this county. There isn't. And that is, you know, that hurts. So we have in our committee, correct me if I'm wrong, we came up with 2 ways that we can communicate them direct, where we don't have to depend on anybody to get them updates on their medical or any benefit within this county, including their pay, anything like that. And the second thing, it is very critical, and it is something that is used as a tool for our brokers, is the preventive screening. We've had it now for the past 5 years under the present plan of Blue Cross Blue Shield. First time we made it known to the employees, we came in with a 42% completion of their pre-screen once a year. Crazy. We said, but we're gonna get the numbers up. So we went back and readvised. That's why the numbers started going down instead. So with that in mind, through the financial management and through this policy here, we have asked our county attorney to construct a letter, which will be going to all our employees, explaining to them, if you do not get your preventive screening, that I'm going to say by March of next year, that's going to be an additional 10% on your insurance. So everybody that used due diligence and went to the physician and got it done, still has to pay the penalty like the one that did not. You think of it common sense wise, and just raise your hand. How many have seen a doctor this year? You realize you get this done when you're sick and you still go see the doctor. You don't have to make a special. And the second time, the employee gets paid for their day off to do it. The only thing we don't do, and I've mentioned it before, is the hire contract Uber, go you can put them in the car and take them to the doctor and bring them back to their house. That's the only thing, and I don't think we need to go that far. But that is a very critical thing. And in the information as to keeping up with who is made, that's going to go lock in place. Next month, more than likely, we'll make a presentation on that small system and how we're going to cope with that. Thank you very much. Thank you, Tim. Ms. Tanner, thank you very much for your information. This time, Madam Chair, I would like to make a motion. I may. I make a motion to authorize One Digital change medical insurance coverage from Blue Cross Blue Shield to Cigna at 1% with a 12% cap the following year. Medical insurance will be budgeted at 15, and in the fiscal year 26, unencumbered medical insurance will be moved to the insurance reserve account.
We have a motion on the floor.
I second.
I'm sorry, who was that? Okay, Terry Profit seconded the motion from Brad Johnson. And you will find Commissioner Johnson's words in
Financial management.
yeah. So item 16B1 is where you can read that motion before we vote. Nick Holder.
I just have a question for them, if that's okay. At one time, Cigna had a PXDX computer program that could look at the diagnosis and tell the person if it's going to be covered. Are they still using that system?
I'm not familiar with that system, but, yes, I mean, that's how we do it at our claims office. So they can call our claims office or the department also, and they can pull up on their system. So all our contract providers have access to know what's covered and what's not covered by the diagnosis code. Or if the member calls in and asks, hey, this is my diagnosis code, or this is the procedure I'm looking at. A lot of times they don't know the diagnosis code. But I'm not sure what the system is, but yes, we do have that in place.
Okay, but that's through y'all, it's not through Cigna, correct?
It's through Cigna, yes, yes.
Thank you, Madam.
Any other questions before we go to the vote? See you then, Madam Chair, it's yours.
All right, I call for the vote on the insurance program switch from Blue Cross Blue Shield to Cigna at a 1% increase.
Childers? Yes. Carol Wiley?
Yes.
Motion passes.
Thank you very much. Passes. I yield. Thank you, Madam.
Thank you. So we're gonna take a 10-minute break, everybody.
Jerry, you trying to kill me, son? Say here.
As long as I can just stand up for a minute.
All right, let's come back to order. We are only about 25% of the way through our agenda this evening, so let's see if we can pick up some steam. We are on, agenda item number 13.
Not here.
I'm sorry, you're right, the finance director's report. Yes, Ms. Watson.
All your reports are in your packet. If you have any questions or comments, feel free to email or call me. Also, some of the packets did not have all of the minutes for FMC and Budget Committee. We have copies of those up here. If you find your packet is missing those items and would like a copy, we have it for everyone. Somebody's missing one. Other than that, that's it.
All right, thank you. Now, item 13. At the mayor's designation, Mark Ridings is only going to be showing up every quarter. So the next time we will see him will be in July. If you all have an objection to this, I wish you would say it now.
Madam Chair,
Yes, sir.
it was brought on the floor to these commissioners, and they said they wanted a monthly statement as to the progress of the project. And it was voted on by this commission. I don't think that whoever gave that order has the authority other than this commission.
He reports to the mayor. And, I can pull up an email. A reason that was given is he will provide quarterly updates so that Motorola can join him during the process and all questions can be answered. This will allow Motorola to be held accountable for the sense of urgency. So, of course, the mayor is with us tonight. If she wants to explain.
The main reason we met and came to that conclusion was the project is still getting off of the ground, and so there hasn't been a lot to report with the road going into White Rock at the moment. We met with Motorola and asked if they would be able to come in with Mark and do the updates. They are only able to do it at a quarterly basis. So we had a consensus that it would be best if all of them would be together in front of the commission for a quarterly report. That way you could actually have some progress and actually ask questions with Motorola here. Those answers could be given instead of Mark trying to go back and get the answers and bring them back. That was kind of the conclusion that was come up with because Motorola could not attend but quarterly. So we thought quarterly reports would work best because Motorola would be here with Mark.
But this commission votes on something, I'm not sure what elected official you are. I don't have nothing opposed to the mayor, but when the commission approves something, I want to see who has the authority to override them. Mr. Attorney, is there anybody elected official that has the right to overrule a commission?
I wouldn't say overrule, but certainly an elected official can decide whether or not they want to come at the request of the commission or not. And the elected official who supervises and hires or fires an employee can direct their employee. I mean, the commission doesn't supervise or hire or fire the communications officer. So you can vote to ask it, and the elected official gets to decide whether or not they're going to honor that request. That'd be just like directing the sheriff to come if he didn't want to come, or directing the registered deeds to come. I mean, they don't report to or answer to the commission. So you can't just give that order.
That was the only thing I had to do. They took the issue on the floor, and then all of a sudden, regardless of what the titlement or anything else, somebody says, no, I'm asking them not to, well. Yeah, that's the gun company that shows. Of course, we do have the right, as we've been told, we do have the right to handle their budget. You get my drift. Is that not correct, Mr. Attorney?
Absolutely, yes,
Okay,
sir.
so if you want to fight the system, welcome aboard.
So, I have communicated to Mayor Whitby and to Director Rawlings that, you know, the request to speak monthly was brought by you to me. And that the reason that I understood you wanted it was timeliness, urgency of spending the money before the deadline. So, all right, so that update will come in July. The EMA office is now handling the disaster update.
Chair, you've got two requests to
Sorry, I am
speak.
so sorry.
That's okay.
Let's accuse.
In respect to timeliness, I would say that if there was something that did need to be approved or funded, that Mr. Ridings would probably be bringing that before us. Is that not correct, Mayor? Like, so if it's something that had to get approved next month, I don't think he'd be waiting for 3 more months.
No.
Yeah, and I mean, and once the project gets really off the ground, we're perfectly happy to have him come back and start really giving those updates. But at this point, we just felt like until it gets really moving, Motorola would be here with him quarterly. And when that started moving quicker, we would look at having them come back in every month. We're just kind of looking at the timeline of the project instead of having him come up in front of you and not really able to give you any substance of what's going on. So that's kind of what we were looking at when we met with Motorola.
Okay, Avery, Wynn, you have the floor.
Yes, Madam Chair, thank you. My constituents, and I talk to many of them just about every day, are asking me the updates on what's going on with the radio tower. I can't tell them because I don't know anything more than what I did last time. Last time I heard they were getting to the tower from off the top of Walnut Mountain, the backside. What do I tell them now?
Mr. Ridings does have a phone and an email if anyone has questions or comments that they need to get back to their constituents.
Todd Smith, you have the floor.
Thank you, Chair. The only thing I'd like to say is, and I don't mean it to sound rude, and I really don't mean it to be that way, but I've had questions from my own first responders that I can't answer. And that's kind of embarrassing. And I do realize that I can call Mark and everything, but we are getting up against the deadline here. And at the very least, I feel that we need to be kept appraised and make sure everything's still on track. That's just my personal opinion. I yield.
Thank you, sir. Anybody else? I'll speak briefly that the reason that I went forward with the request to him to come monthly was because he wanted it, but also because I agree with it. Whenever we're not all together and reports are given, we don't all get the exact same information. And I know that's not anybody's fault, that's just life, it happens. But I like it when we're all told the same thing at the same time, and that way there's less miscommunication. There's no misconstruing it. So that's my reason. And so, Mayor, after this discussion tonight, if you'll just think about it and express to Mr. Ridings how several commissioners feel, and we'll take it from there. But tonight, he's not with us, so we're gonna move on. To item number 14, the disaster update from the EMA office. And Director, is it Richard?
Almost close.
Okay.
It's good.
I'll try, correct me, please.
It's Umrican.
Umrican, okay. So it's pronounced like a K. All right, thank you so much for being here.
You're welcome. It's my honor. So I have a little bit of information where we stand with our FEMA and the recoveries. Our category A is our debris. We're currently working on the right of ways, and we're going to start the restoration for the two properties, one at Roan Mountain and the other one at the church in Hampton. Quotes were obtained. They were both going to need RFPs. The waterway debris, we have been working with TEMA and contractor P&J to try to get all the debris piles taken out and all the vehicles out of the waterways. They have cut down some of the areas that we had sent them, only for the simple fact that it doesn't fit their criteria, which is within a structure, cannot be within the culvert or cause further damage. There is a hard cutoff for debris removal, and that is going to be May 24th, Friday. Okay? FEMA will not reimburse anything after this date for any kind of debris. Okay? Our category B, which is emergency protective measures, we're still in the process of putting a few applications. One for First Baptist Church in Road Mountain. All the other pre-applications have been in or in process of being submitted. The temporary bridge contract signed with TEMA. We're anticipating the funds 30 to 60 days. Our category C, which are our roads, we've got 16 highway projects at the CRC, site inspections and damage, all sent to FEMA. They're at the CIC for their cost analysis. The NRCS project, 37, we can't fix the roads until the banks are secure. So FEMA gave us a waiver MRU and documented that we must do the NRCS for Shell, Hampton, and Creeks. The NRCS inspector, we're waiting for the package. We basically took 52 sites and running 4 projects based on proximity to each other. 11 of those sites are on Shell Creek, and RCS has been packaged. Hospital, Summers and Taylor, since they're on state contract, and we're also looking to try to get Baker Construction for the Heaton Bridge. We have 2 out of the 4 groups for the NRCS projects ready to start work. Paperwork Friday, including Shell Creek and Heaton Creek. All the projects have been submitted, and those which have been obligated, we have received a letter, a contract with TEMA, so now we will be able to start seeing some of those funds back. Our category E, we've completed the site inspections. We need the documents of the contents, and 1206 project completed, building and codes planning. We need the scope and the actual cost. The goal is to have, at the end of May, all the projects to the CRC. Our Cat G, which is our parks, we got information and debris was staged at Anderson Park. We're working currently on 1 grant application, which is a $1.5 million local park and rec grant with 50-50 through Appalachian Coalition. No cost to the county, but we still need to submit applications by June and hope we'll have an answer by July. The site inspection still needs to be done. And we are still working on gaining and putting together our Cat Z, which is all the administrative costs. So any time spent working towards this disaster can be recouped under that. And that's what I have. Questions? Thank you.
Thank you, Director. It's time for public comments. If there's anyone here wishing to speak to the commission this evening, please come forward. State your name and what district you are in. Okay, we will move on to item 16, which is monthly committee reports. Item A, Budget Committee Chair, Commissioner Dr. Ron Baker.
Thank you, Madam Chair. We have 21 items tonight. I'll try to move through these as quickly as possible. First two items you'll find in your packet, I believe, under the minutes of the Budget Committee on May the 12th. Please find them. That's where mine were in the packets. You should find them there as well. And as usual, the items under the Budget Committee we passed as amendments are found in the same place. Not read every item, but just the general description. And if you have questions about what those amendments, those items are under the amendment, I'll be happy to read them. But otherwise, it will be a limited meeting to pursue that. So under 16A, item number 1, and I'll make the motion to approve a resolution to increase the rate of mineral severance tax levied in Carter County, Tennessee.
Second by Todd Smith.
Thank you.
Any questions about this?
Right. And before I ask the county attorney to read this into the record, I want to thank Leslie Hughes for bringing this to my attention. We're always looking for additional sources of revenue. And she thought this passed by the General Assembly and signed by the governor. So I don't know how much revenue total we get out of it, but at least every little bit. County attorney?
Read.
Yeah.
This is a resolution to increase the rate of mineral severance tax levied in Carter County, Tennessee. Whereas pursuant to the authority set forth in the Private Acts of 1981, Chapter 79, approved by the Tennessee General Assembly, as ratified by a resolution of Carter County Legislative Body, severance tax was levied on all sand, gravel, limestone, phosphate rock, and all other mineral products severed from the ground within Carter County. Whereas pursuant to the terms of said private act, the rate of the severance tax is currently 15 cents per ton, and all revenues generated therefrom, less the expenses of administration and collection of the tax, become part of the general fund of Carter County, subject to the appropriation of the county legislative body for the use and benefit of the county road department. Whereas pursuant to House Bill number 695, adopted in the Tennessee General Assembly and signed into law as Public Chapter 285 on April 24, 2025, Tennessee Code Annotated Title 67, Chapter 7, Part 2 was amended to allow the rate of said tax to be set by the county legislative body in an amount not to exceed the following amounts per ton. For a tax period beginning on July 1, 2015, or July 1, 2025, 15 cents per ton. Beginning on July 1, 2025, and up until July 1, 2030, 20 cents a ton. July 1, 2030 to 2035, 25 cents a ton. 2035 to 20, and thereafter 30 cents a ton. Whereas pursuant to the aforementioned authority, the county legislative body may increase the rate by adopting the resolution by a 2/3 majority vote. The presiding officer of the county legislative body thereafter delivering a certified copy of the resolution increasing the tax rate to the Department of Revenue. Whereas the Carter County Budget Committee has studied this issue and has recommended the adoption of this resolution by the Board of County Commissioners to increase the rate of said mineral severance tax in Carter County to the maximum amount permitted by law. Now, therefore, be it resolved by the Board of County Commissioners for Carter County, Tennessee, meeting in regular session on this, the 19th day of May, 2025, with the lawful quorum of said board being present, authority voting in the affirmative as follows. Such authority granted via Public Chapter 285 is signed into law on April 24th, 2025, amending TCA Title 67-7-2. The board hereby adopts this resolution to increase the rate of the mineral severance tax levied in Carter County to the maximum amount permitted by law, which will be 20 cents per ton for tax period that begins July 1, 2025, prior to July 1, 2030. To the extent possible, the board also hereby fully approves the future increases in the mineral severance tax levied in Carter County to the maximum amount permitted by law, which will be 25 cents per ton beginning 2030, and 30 cents per ton after between 2030 and 2035. Be it further resolved that this resolution shall take effect from that the day of its approval, the welfare of the county demanding. Be it further resolved that all resolutions of the Board of County Commissioners in conflict with this resolution are hereby repealed. And be it further resolved that the presiding officer of the county legislative body shall deliver a certified copy of this resolution to the Department of Revenue.
Thank you, County Attorney. One of the things that Todd Smith pointed out in our budget committee, we probably have other quarries and other mining operations that hadn't complied with the original intent of the income tax. So hopefully this will raise some awareness. When those are identified, we can ask the county attorney to send a reminder or post office, however we decide to do this, to encourage them to pay those taxes. So are there any questions about this resolution? Commissioner Johnson.
Chairman, who is the enforcement arm of this resolution? Who, we obtain your business license? Is it up to the sheriff? Is it up to our constable? Who's the enforcement or the oversight of it?
Well, I think I can answer. So I was unaware of this tax, frankly, until it came up. And it is by private act here in the county. There is a general law that went into effect in 1984, and it's done through the Department of Revenue. But Carter County adopted this by private act in 1981. In that private act, the collection is through the county clerk's office. In that way since then, they have a form. It's sent in monthly, sort of like a tax return form, sent in monthly to the clerk's office from those who are in this line of work, those companies doing this. The enforcement at the time was obviously a little antiquated. It says the DA and the county judge, that's not going to happen anymore. So you fall back on me as the county attorney if I'm requested to try and collect this from folks who aren't paying. And it sets in here some delinquency. These fines and things are not legal anymore. The highest amount the county can fine anybody is $50. So some of this stuff is a bit antiquated, but it's what we have. So it's me. If you're aware of, or you all become aware of, some company or individual that is selling this material and they're not paying the tax, bring it to my attention and I'll try and collect it. As far as I'm aware, from talking to the folks in the clerk's office, there's really only one company right now that submits these, and I think it's or whatever that name is now. They submitted. I'm not aware of another one. So happy to do whatever I can to enforce this. Y'all provide that information.
So the question is, so to find a solution, our businesses in the county renew their license every year, is that correct? So that means the clerk's office, if they've not abided by or rendered or whatever, then that in itself, you could deny the business license, couldn't you?
No, not really. I mean, that's not a penalty that's set forth in the act. It's, there's a fine. We can judgment against somebody for unpaid taxes and delinquent penalties, but you can't really deny them the right to do business for non-compliance.
Any others?
I call for the vote on this resolution to increase the rate of the mineral service tax in Carter County.
Childers?
Yes.
Carol Whiteley?
Yes.
Okay, thank you. Vote passes 19-1. Second item on our list, and I'll make a motion. Approve a resolution to request the unclaimed balance of all accounts remitted to the state treasurer under the unclaimed property tax. also find that resolution under the budget section.
I have it.
Okay, so for convenience, let's go with a second by Leslie Hughes. Commissioners, do you have questions or comments?
Some of you may recall, County Attorney can opine on this. We did this in 2021. Requested those items that went back to the Tennessee, or those dollars that went back to the Tennessee State Treasury that were submitted to them by Carter County. And I don't remember the exact amount of charge that we realized from that, but it wasn't small.
It was significant.
I think there was around 500,000, is that correct?
It may have been more than that. Well, not in 2021. So we started it a few years prior. There was many years that hadn't been done before that. And that was the substantial year. And I can't remember 2021 exactly. This year, rather than read, I'm happy to read this, but it would make more sense just to summarize it. So all the offices in the county that collect money, and it's generally the court clerks, are required to hold funds that are unclaimed for a certain period of time, try to notify the owners. If they're unsuccessful, they have to send it into the state Department of Unclaimed Funds. And after it's held there for 18 months, it can then be claimed back by the local government who sent it. So that's what this is. These funds were sent in more than 18 months ago. The county is requesting the state to send these funds back because the state's just holding them in an investment fund and making money off of them. So these funds can be remitted back to the county to go in our general fund. We have to hold out a certain portion in case claims are made, because they still can be made. But if they're unclaimed and remain in our fund, we can use it in the general fund. And we've gotten a substantial amount back in the past, and only since I've been around, I think 2 claims have been paid back for those who had claims to get it back later, and those weren't that substantial. So it seems to be a win-win to get this money back in the county. Even if it's held not used, you're still making money off of this money, and the vast majority of it will probably be able to. It's mostly court fines and fees and things like that the owners just cannot be located, and they haven't. They've overpaid an amount, or there's some money owed to them, or some money collected on a judgment through the clerk's office. They simply cannot locate anybody to forward the funds to it.
Any questions? If not, I'll have the county attorney read the resolution short for the record.
This is a resolution to request the unclaimed balance of all accounts remitted to the state treasurer under the Unclaimed Property Act. Whereas Tennessee Code Annotated 66-29-146 provides that the county of Tennessee may request payment for the unclaimed balance of funds reported and remitted by or on behalf of the local government and its agencies if it exceeds $100, less the proportionate share of the cost of the municipal program. Whereas Carter County and or its agencies have remitted unclaimed accounts to the state treasurer in accordance with the Uniform Distribution of Unclaimed Property Act. Whereas Carter County by this resolution is requesting the return of the unclaimed balance of any and all available funds held by the state treasurer which have been remitted by Carter County and or its agencies. Whereas Carter County agrees to meet all requirements of Tennessee Code Annotated 66-29-101 et sec. To accept liability for future claims against accounts represented in funds paid to it. Whereas it is agreed that Carter County will retain a sufficient amount to ensure prompt payment of claims, and that the balance of funds will be deposited into Carter County's general fund. Now, therefore, be it resolved by the Board of County Commissioners for Carter County, Tennessee, meeting in regular session on this, the 19th day of May, 2025, with a lawful quorum of said board being present, majority voting in the affirmative, that the board hereby requests the state treasurer to pay the unclaimed balance of funds to it in accordance with the provisions of Tennessee Code Annotated 66-29-146 subsection C. A list of remittances made by or on behalf of Carter County and its agencies is attached hereto. Be it further resolved that this resolution shall take effect from and after the date of its approval, the welfare of the county demanding Be it further resolved that all prior resolutions of the Board of County Commissioners for Carter County, Tennessee, which are in conflict with this resolution, are hereby repealed. I will say the attachments are with this resolution, and it's a little over $500,000 that we would be requesting.
At this time, let's vote on this resolution to request the unclaimed balance of all accounts remitted to the state treasurer.
Lisa Childress? Yes. Carol Whaley? Yes.
Thank you. Motion is unanimous. We'll move on to item number 13, and I'll place into motion to approve capital project fund, budget amendment 171-1, item 1, in the amount of $380,000, with $380,000 coming from reserve funds, coming from the.
Sharon, you're on the wrong page. You're on the wrong page. Y'all remember? You're on number.
Thank you. So let's go back to item 3.
There you go.
And this is a motion to approve, make that motion to approve the check request and payment to Sidekick Excavation in the amount of $1,800 and purchase order to Sidekick Excavation in the amount of $1,800 for 1 month septic cleaning of the house.
Motion is seconded by Jason Clausen. Are there questions? Let's vote.
Lisa Childress? Yes. Carol Whaley?
Yes.
That is unanimous. Thank you. I'll make the motion on item number 4 to approve payments to Thompson and Litton for invoice number 111329 in the amount of $2,100 for architect fees for the Happy Valley Middle School roof replacement.
Seconded by Alyssa Hughes. Any need for discussion?
Just one question. What fund is that one coming out of?
Comes out of the 141. Comes out of 141.
Anything else? All right, let's vote.
Lisa Childress? Yes. Carol Whaley?
Yes.
Unanimous, thank you. Item number 5, I'll place into motion to approve payment to Thompson and Litton for invoice number 111324 in the amount of $11,500 for architect fees for the Happy Valley High School roof replacement.
Seconded by Gary Kemp. Any questions?
It's coming from the same fund.
Let's vote.
Lisa Childress? Yes. Carol Whaley?
Yes.
Thank you, that is unanimous. Move on to item number 6, and I'll place into motion to approve payment to Mountain Electric in the amount of $1,195.30 for services rendered February 21, 2025 through April 22, 2025.
Motion seconded by Jason Clausen. Sorry, sir.
That's to provide electricity and podium meals at the sheriff's office. Sheriff's house.
Any questions? Please vote.
Lisa Childress? Yes. Carol Whaley?
Yes.
Thank you. It is unanimous. Item number 7, and I'll place into motion to approve county fund budget amendment 101-10, items 1 through 16, in the amount of $32,184.27 with $899,244.71 coming from reserve accounts, but nothing coming from unassigned fund balance.
Motion is seconded by Avery Lynn. Any discussion needed? Let's vote.
Lisa Childers,
Yes.
Darrell Waley,
I will abstain on that one. Abstain. on that one.
Passes 19 with an abstention. Let's move on to number 8. I'll make a motion to approve the fund budget amendment 122-5, item 1, amount of $850 with nothing coming from fund balance from 122 fund balance.
Motion seconded by Danny Deal. Seeing no questions, let's vote.
Lisa Childers,
Yes.
Darrell Waley,
Yes.
Thank you, that's unanimous. Move to item number 9, and I'll place into motion to approve Park Recreation Fund budget amendment 123-1, items 1 and 2, in the amount of $31,140.45 with $20,412.80 coming from reserve accounts, but nothing coming from fund balance from 123 fund balance.
Seconded by Danny Deal. Questions? Okay, let's vote.
Lisa Childers,
Yes.
Darrell Waley,
Yes.
Thank you, that is unanimous. Item number 10, I'll make the motion to approve special revenue fund budget amendment 127-1, items 1 through 5 in the amount of $893,484.31 with $893,484.31 coming from reserve funds and nothing coming from Fund 127's fund balance.
Seconded by Aaron Frazier. Comments? Please vote.
Lisa Childers,
Yes.
Darrell Waley,
I'll abstain on that one as well, please.
Thank you. Passes 19 with 1 abstention. Moving on to item number 11, motion to motion to approve Highway Fund budget amendment 131-7, items 1 through 3 in the amount of $34,123.80 with nothing coming from the Highway Fund balance.
Seconded by Gary Kim. Are there any questions? Please vote.
Lisa Childers,
Yes.
Darrell Waley,
Yes.
Thank you. That's unanimous. Item number 12, I'll place into motion to approve debt service fund budget amendment 1-1, item 1, in the amount of $259,113.81 with nothing coming from the debt service fund balance.
Seconded by Gary Kim. Any questions? All right, let's vote.
Childers,
Yes.
Darrell Waley,
Yes.
It's unanimous, thank you. Now we get to item number 13, so I'll place into motion approve capital projects fund budget amendment 171-1. Item 1 in the amount of $380,000 with $380,000 coming from reserve accounts, nothing coming from capital funds, fund balance. That's for the HVAC at the jail.
Motion is seconded by Todd Smith. Let's vote.
Lisa Childress?
Yes.
Carol Whaley?
Yes.
Thank you, that is unanimous. Item number 14, I'll place into motion to approve general purpose school fund budget amendment 141-7, items 1 through 8, in the amount of $1,861,478.23, with $150,000 coming from general purpose school fund 141 unassigned fund balance.
Seconded by Leslie Hughes. All right, let's vote.
Lisa Childress?
Yes.
Carol Whaley?
Yes.
Thank you, that is unanimous. We'll move now to item number 15, and I'll place into motion to accept School Federal Projects Fund, Budget Amendment 142-8, items 1 through 3, in the amount of $36,932.21, with nothing coming from the unassigned fund balance. Schools unassigned fund balance.
Acceptance is seconded by Danny Peel. Let's vote.
Lisa Childress?
Yes.
Carol Whaley?
Yes.
Thank you, that is unanimous. We'll move on to item number 16, which I'll place in the motion to approve the school nutrition fund budget amendment 143-3, items 1 and 2, in the amount of $19,625, with money coming from the unassigned fund balance.
Motion seconded by Aaron Frazier. Are there questions?
Lisa Childress?
Yes.
Excuse me, yes.
Carol Whaley?
Yes.
That's unanimous, thank you. We'll move to item number 17, and I'll place into motion to approve Head Start Fund budget amendment 145-5, item 1, in the amount of $7,974.56, with nothing coming from the unassigned fund balance.
We have a second from Jason Clausen. We're voting.
Lisa Childress?
Yes.
Carol Whaley?
Yes.
Thank you, that is unanimous. Move on to item 18, which we amended before the agenda was approved. This motion is to approve animal shelter monetary donations in the amount of $2,645.
We have a second from Aaron Frazier. Are there comments or questions? All right, let's vote.
Lisa Childress?
Yes.
Carol Whaley?
Yes.
Good, that is unanimous. Item number 19, I'll make the motion to approve the animal shelter non-monetary donations in the amount of $225.
Motion is seconded by Commissioner Nick Holder. Seeing no questions, let's vote.
Terry Prophet? Lisa Childress?
Yes.
Carol Whaley?
Yes.
Thank you, that is unanimous. Let's move Move on to item number 20, and I'll place into motion to move forward with the RFP process for the ground restoration of the Lone Mountain DMA site. This expense should be reimbursable by FEMA.
Motion is seconded by Steve Early. Anyone wish to speak? Please vote.
Lisa Childers,
Yes.
Carol Whaley,
Yes.
Thank you. It is unanimous. We'll move on to the last item. Item 21, I make the motion to approve to move forward with the RFP process for ground restoration for the Hampton Church Lot DMS site. This site was not in a TEMA-approved debris site and will not be reimbursable by FEMA, so the county will be responsible for the full amount of the restoration contract.
Motion seconded by Aaron Frazier. Does anyone have a question? Okay, let's vote. Oh, I'm sorry, Leslie, you may speak before the vote.
I know this is to move forward with the RFP. Do we have any idea how much this might be? It averaged between 78,000 and 101,000.
Any others?
I'm sorry, one more follow-up. Is this where some of the citizens just started bringing some stuff down? Yeah, it's the property right behind the Dollar General in Hampton where the church agreed to volunteer the site for debris, but then ended up citizens, and it kind of turned into a spot that was convoluted with debris, and now the church wants their property back, but it's cleaned up, but there's a lot of metal and a lot of other things that they're scared to walk on, so we're gonna have to take that topsoil off and put about 5 inches of on, and that's what the expense is. And then we have to hydro seed it with grass and the full blown, so we can get the property back. The Road Mount property is covered under FEMA, so we'll get that reimbursed, but the church property, they graciously let us use it, so I feel like we should graciously reimburse them back for what they were able to do for us.
Anybody else? Yes, Councilman.
I would like to add that that lot being able to be used was a lifesaver for Springs Street. Without it, I'm not sure what we would have done. First of all, thank First Baptist for doing that. And it really saved us a lot of work up there on Spring Street.
Others? Okay, we're voting.
Profit. Lisa Childers,
Yes.
Carol Whaley,
Yes.
Passes 19-1. So, motion passes. Thank you.
Thank you, Chairman Dr. So, Commissioner Brad Johnson. Come back in the
Financial management, we've already completed number one, the presentation of insurance. We'll go to number two, which is a motion to approve the grant contract between the State of Tennessee Department of Military, Tennessee Emergency Management Agency, and the Clark County government for reimbursement of loan charges and interest. In the packet, you will have the contract and its explanation and all the standards that have been reviewed by our legal.
Motion is seconded by Dr. Bob Cato. Does anyone have a question? Okay, let's vote.
Lisa Childress? Yes. Carol Wiley?
Yes.
Thank you, unanimous. Item number 3 is the motion to approve a resolution to increase the competitive bid threshold and adopt amending purchasing regulations for Carter LLC. In your packet, you will have the requisition process. In the dark colors are the changes and the updates. This is a inspection item with our auditors during the year. Update.
So that motion has been seconded by Dr. Bobby Cook. Does anyone have a question? Dr. Echo?
No.
Okay. Anybody? All right, let's vote.
Lisa Childress? Yes. Carol Wiley?
Yes.
Mr. Smith?
Fell asleep for a moment.
Unanimous, thank you. Number 4, a motion to approve the disposal of surplus property for the Highway Department dated 4/2/25. The disposition sheet is in your packet, and it is a paper shredder and scrap multiple.
Right, Jason Carlson on the second. Any questions? Let's vote.
Gary Crawford?
Yes.
Lisa Childress? Yes. Carol Wiley?
Yes.
Next, item number 6 is the motion to approve disposal. Hang on. No, this is number 20, this is number 5, couldn't I? Motion to approve disposal of surplus property from school nutrition day 4/7/25. One of them is the hot water heater, and the other one is a beverage or cooler. Both of them are scrap.
Motion is seconded by Danny Hill. Let's vote.
Lisa Childress? Yes. Carol Wiley?
Yes.
Unanimous, thank you very much. The next, number 6, is a motion to approve the disposal of surplus property for the trustees office, 4/29/25. In your packet, with that, you find the property as surplus. The reason for it is the upgrading. It's in good condition, and those will be sold with better deals. The further disposition documents will give you the name and the serial number.
We have a second from Harry Campbell. Andy first. All right, let's vote.
Gary Crawford? Lisa Childress? Carol Wiley?
Yes.
Motion carried. Last one is a motion to approve the disposal of property, surplus property for the animal shelter dated 4/9/25. In that document, it is effective non-operative laptop and then 3 different laminators. All of them are to be disposed, none of them is operational.
We have a second from Avery Lynn. Let's vote.
Lisa Childress,
Yes.
Carol Whaley,
Yes.
Motion carried. Madam Chair, our remnant time back. Hello, Lou.
All right, we're coming to the podium is nominating committee chairman, Danny Deal.
Okay, first item is a motion to appoint Patricia Taylor to the Carter County Parks and Rec Board, to fill the 1st district vacancy.
We have a second from Harry Sheehan. Anyone have a question? Please vote.
Gary Crawford,
Yes.
Lisa Childress,
Yes.
Carol Whaley,
Yes.
Second, motion to appoint Josh Dalton to the Carter County Parks and Recreation Board, to fill the 7th district vacancy.
We have a second from Aaron Frazier. Any questions here? All right, let's vote on it.
Gary Crawford,
Yes.
Lisa Childress,
Yes.
Carol Whaley,
Yes.
Thank you, Chairman Hill. Rules and Bylaws Committee. Chairman Avery Lynn.
No speeches tonight. Well, I just had this twice, 2 months. I'm thinking it bring it to motion to approve resolution to recognize Angie Odom on being named the Tri-Cities Region for remarkable volunteer year for 2025.
Have a motion seconded by Danny Deal. Any comments or questions? Yay. All right, let's vote.
Gary Crawford,
Yes.
Lisa Childress,
Yes.
Carol Whaley,
Yes.
All right. Danny Deal, would you like to speak?
No, Jerry would, he don't have a phone. Jerry don't have a phone, so that or maybe phone.
Okay, so just for clarification, we have 20 present tonight. But that still means our quorum number is 12, so we have met it. Is that correct, Attorney?
It's 23 members, 12 is the majority.
Yes. Okay, so because we're 1 short, right now, 12 is the majority. All right, so that motion has passed. It's time for the county attorney report, item number 17.
Let me say before I do that, I don't know how we got speaker either. It should have been Health and Welfare Committee. That was my mistake.
It's all right.
Anyway, we got it done.
You want Brad to read your county attorney report?
Sure. You're available.
We got big work in it.
All right. So I will say, while we're starting on that, if your committee passed a resolution that got approved tonight, please stick around for a minute when we adjourn, so everybody can sign those while we're here, because if we don't do that, it ends up being an ordeal. You'll sign later. So if your committee passed one, stick around for just a minute, I've got the originals to sign. As always, just a general litigation update. Of course, the legal regulation cases that proceed through planning office and we prosecute in Chancery Court are still ongoing and will be ongoing for the foreseeable future. until properties come into compliance. There were 2 new cases filed this month in U.S. Federal District Court in Greenville, naming Carter County as a party, both by either current or former inmates at the jail. Those are very early stages, just filed this month. Referral's been made to the insurance carrier. So those will be ongoing for quite some time. And as always, if there's an individual question of those, you can contact me and I'll answer them. Otherwise, a discussion in depth would require an executive session. As always, the work performed every month is in a written report that I will include with the county commission meetings. And as always, if there's individual questions from any of you all at any time, I'm happy to answer them. And if you've got questions tonight, I'm happy to answer it. That will be my report.
Does anybody have a question for the attorney? All right, we move to item 18, which is commissioner comments. Would anyone like to speak? Yes.
I just have one thing, I just want to update earlier, but I was trying to get one digital out of here. The governor opened up his governor response and recovery fund. The applications opened up this month, they closed at the end of the month. So we went through the needs of the county on what we could apply for. And so what we chose to apply for is on the Cat C line item, the $40 million for roads and bridges. The county is on the hook for a 5% match. We applied for that 5% match, which is $6 million. E, the county is vehicle, ATVs, the grade all, solid waste equipment purchases, and any upgrades that we did during the disaster on equipment. That was $1.2 million in purchases. We applied for that to be reimbursed. The hazard mitigation grant is $1.7 million right now that we're submitting for. That is a 12.5% match from the county, which is $1.4 million. We've applied for that match also. So in total, Carter County has applied for $8.6 million in this application to come back to us for what we would spend in matches or what we've spent out of the general fund for equipment purchases. And as of date, there has been 75 applicants in this fund. The fund's $100 million, $110 million has already been requested, and there's still a week and a half open in this application process. So just to give you an update, we're looking pretty good on the application. We have been flagged and we're keeping an eye on it. Everything is submitted, finance department and with the contractor, we've all worked together and submitted everything. So we'll know soon, and then I'll update you next month at the commission meeting as to what we've gotten from the fund. And also, commissioners, wanted to do a little bit of a public service announcement on Watauga Lake. As you know, the cleanup is finishing up on the 24th. There is still to the marinas and to a lot of the citizens about being careful on that lake, education for the lake, because there is still a lot of debris there. There's still concerns for safety. If you also want to pass that along to your constituents, especially in the 6th and 2nd district, we're going to have out-of-towners who do not know that a hurricane hit this area, and they're going to come in, they'll be on their jet skis, their ski boats, and their pontoons, and so we've really got to do some education on that. We're working with TEMA to get some infographics out and social media hits, so just some due diligence on Watauga Lake as the summer season kicks off.
Thank you, Mayor. Anybody else? Okay, if you all will, please look at your June calendar of meetings. Notice that our next full commission meeting is on June the 5th at 6 p.m. That will be the special call with budget meeting at 6 and full commission to follow. Does anybody see any needed changes or announcements?
Correct that time on June 16th. Full commission meeting.
Yes.
Such time as 0.
Okay, so June 16th
At 6 p.m. That is a little early in the month compared to the normal, so don't let that one slip by.
Next month.
Anything else?
Motion to adjourn.
Motion to adjourn, is there a second? Second by Avery.
when the meeting stands adjourned.
Yeah.